everyone, and welcome. Hello, Instagram over there. Happy to see you. And I've got Facebook right here. You'll see me bouncing back and forth from both cameras. Today, we're going to talk about local anesthesia administration for our pediatric patients. So that's our topic today. And we'll get started here in just a moment as people are coming into the live session. As a reminder, this is recorded and you can see it on the Teacher Tina RDH YouTube channel as well. But we are going to go ahead and get started with our live review of local anesthesia with for our pediatric patients. And this comes from mainly requests. I've had individuals request some information on this topic, and not just on pediatrics but on our geriatric patients as well. So I figure I'll kind of touch on both of these at the same time. So a little bit about kiddos and a little bit on our geriatrics. So again, hello Facebook friends over there, and hello Instagram fam over there. Happy to see you guys, and thank you for joining. It's March 19th. Today I got to do patient care, which was wonderful. Forewarn you, you may see the kitty cat jump up onto my lap. I already had to knock him off of my lap once already today. So I'm just in the minute of getting all this set up. It was a busy day. Today was Friends and Family Day at the dental office because I work clinically on a very rare basis now. I'm mainly teaching hygiene students or going around the nation speaking or certifying hygienists in different states on local anesthesia. So I still get to practice clinically. I love it. And today was Friends and Family Day. I got to see so many of my family members, my mom and my significant other, and his kids, and his daughter, who's 18. She had Lafort surgery a couple of months ago, back in the summertime. And if you don't know what Lafort surgery is, basically it's the surgery that's done where they take the maxilla and the mandible, lack of a better term, saw the bones, readjust so the bite comes back together. And so we're getting to work with some of the post-operative aspects of that. She's got a little abscess happening, and we're in the process of identifying that. So that was kind of an interesting aspect of the day for sure. And so I digress from that. But yeah, if any of you are experienced or know anything about Lafort, I think that's pretty cool. All right, so hopefully you guys are able to see me okay here over on Instagram. If you can see me on Instagram, just give me a hi, a hello, some hearts or something like that. It looks like I can't tell if my camera's frozen. And same thing with Facebook friends. If you can see me, just put a thumbs up or a hi in there so that way I can tell that you guys can see what's going on, because I'm not quite sure why everything's frozen. Oh, good. Thanks for the heart. I appreciate that. All right. So again, injections for our pediatric patients. Thank you. I appreciate it. Yay. Good. I'm glad you can see things. Injections for our pediatric patients. Again, this is a request that came down through someone. Actually, I've received it a couple of times, I think through email and social media. Maybe it was the same person, several different people. I will say this. I would not consider myself an expert with the administration process of anesthesia for the pediatric population. I've done it a few times, or more than a few times, but I wouldn't say that I would be your go-to person to find out on strategies of managing our pediatric patients. But I can share with you what I have learned through the years and what I've learned from my colleagues who do specialize in pediatric dentistry, what I've learned from them, okay? So I just want you to be aware of that. Now, with pediatric dentistry, I will say that when it comes to anesthesia administration and it comes to the amount that we give, the American Academy of Pediatric Dentistry does have a different dosaging system for our patients. And they basically are using the traditional or the older milligrams per pound and absolute maximum recommended dosaging that we used to have for everybody. So, for example, lidocaine, it's 2 milligrams per pound for lidocaine, no more than 300 milligrams per pound for lidocaine, which, depending upon the patient, that's basically going to be about 5 to 6 cartridges on some of our pediatric patients. The other thing with our pediatric patients, we have to remember, like, their organs are developing, and that is the population. Our kiddos and our frail elderly are the ones that are more likely to have anesthetic overdose. So I want to remind you of that. So you do want to be a little more conservative with your anesthetic administration as the volume of anesthetic that you give. So when you're working with kiddos, I will say that if they don't have their first molars yet, more than often than not, you will probably get away with a short needle and infiltration style injections around the areas that you want to anesthetize, even on the mandible. Don't have to do a mandibular block. You can just do some infiltration injections right along into the vestibular fold. So that would be where we would maybe if you're sitting kind of more of an 8 o'clock position, coming in an anterior and just inserting down towards the in the mucobuccal fold. Okay, down towards the mucobuccal fold is where you're going to go. Okay, sorry, I'm bouncing back and forth between two different cameras because I still haven't invested any of the technology that allows me to do all of this on one screen. So if they don't have their first molars yet, you can just infiltrate buccally in the mucobuccal fold, whether it's the maxilla or the mandible. If they do have their first molars and you are needing to anesthetize those mandibular first molars, this is going to be kind of one of those things where you have to think about your patient's age and size, their capacity to stay open. You could do a traditional block, but especially if those molars are just newly erupting, maybe it's in that 6 to 8 year old range. Again, you could probably get away with doing a mandibular infiltration, especially if you're using an anesthetic like articaine, which is wonderful, beautiful articaine. Septicaine is the trade name, articaine is the generic, which does a great job of penetrating. That anesthetic does a great job of penetrating into that thick cortical bone of the mandible. Okay, so even if you're working on adults and you have to do mandibular infiltrations, articaine will be your friend for this. Okay, I will say that. If they're older, say second molars have erupted, this is when you're going to go ahead and go through with your traditional blocks. So if they're of the age of 12, 13 years old and older, you'll go through with your traditional mandibular block. You could do your IA, you could do a Gaugates, you could even do a Vazirani Echinosis, which is that closed mouth technique. Okay, any of those options will work for you. So usually I would say that majority of these questions revolve around mandibular injections on our pediatric patients because of do you give a block? Do you not give a block? Again, a lot of it depends upon everything that you need to do. But if they don't have their first molars, if it's all primary teeth, you can get away with mandibular infiltration. If they have their first molars, depending upon their size, you might be able to still get away with mandibular infiltration. Use your articaine. But once those second molars have erupted or they're of the age where they have developed that jaw space, you would probably go ahead and do your traditional mandibular block. Now, in regards to that, depending upon your needle size, generally a 27 gauge would be your best bet. You can use a 30 gauge needle. That's going to be your red cap. Your 30 gauge is going to be your red cap. Your 27 is going to be a yellow, maybe sometimes orangish looking cap, and your 30 gauge is your blue cap. Remember, that's gauge is the size of the lumen. So a 25 gauge is going to have a nice big, huge lumen, where the 30 gauge is going to be a little tinier. Okay, so the higher the number, the tighter and the tinier that lumen is. If you're infiltrating a 27, 30 gauge, you should work just fine. If you're doing a mandibular block and you're choosing to use a short needle on a pediatric patient, definitely that's doable because they don't have the jaw width. I would encourage you to stick with a 27. I wouldn't go to a 30 just because of the needle deflection that happens with that. I would stick with a 27 if you're going to do that. All right. But you're never wrong to use a long when you're doing a mandibular block, even if it is on a kiddo. It just might make it a little bit more challenging to stabilize because their mouths are tinier. And as we insert, it's nice to have that stabilization there. Okay. All right, friends. So if there's questions, let me see if we got any questions that have rolled through. I don't see any questions that have rolled through over here at all either. I hope this helps for some of you. Remember, if you missed it or if you want to watch it on repeat, you can go to the Teacher Tina RDH YouTube channel and subscribe to that and you'll see this. I'll be uploading it in the next 24 hours. So you'll be able to see that there. Okay. And just an FYI, if you're curious where else you will get to see me, at the end of March, I will be speaking for today's RDH, doing a medical emergencies class, CE course for today's RDH. It'll be 2 hours. Just go to the today's RDH website and you can register for that. And then also some anesthesia certification courses in Georgia, and I'm doing one here in Oregon as well. And I'm working on coming to a few places around the nation to be able to speak. Vermont, if anybody here is from Vermont, it looks like I might be coming your way this June. So, and I'll be at RDH Under One Roof at the end of July, and maybe we'll see. There's a few other ones that are on the works. I'm just working on working on the details, crossing the T's, dotting the I's, as we say, right? Okay, friends, thank you very much for tuning in. If there's another topic that is of interest to you, please let me know. Remember, final thoughts. Remember that your anesthetic dosaging with our pediatric patients is going to be significantly less. Please look at their medications, especially with some of our younger children and all of the medications that they tend to go on for behavioral items that are happening. Really pay attention to those and make sure you aren't doing an anesthetic that might have a contraindication with that particular medication or vice versa, okay? All right, friends. Well, until next week, I hope that you have a wonderful time. Spring break is happening next week, and I'm excited for a little bit of a little time off, and I hope you are too. I hope you get to have some time off. So until then, my friends, cheers. Goodbye.